Hey everybody, it's Dr. Wellwood and welcome to the clinic. Today in your daily dose, we're going to talk about some new research that's been shown to be relevant in my practice and should be relevant in your life. And so we're going to talk a little bit about sleep and some diet issues and some depression issues and kind of go into musculoskeletal stuff as well. So all the research that I talked to you guys about is brand new. It's no more than a year old. And most of the time it's within the last month or so. So just go ahead and sit back and just kind of absorb what I'm trying to help you guys out with and try to understand. So the first thing we're going to talk about is an opinion primer or an opinion paper that came out from the National Sleep Foundation. And they're just kind of putting it out, saying that, hey, we're behind you guys and actually trying to reduce stress, and because a lot of stress is causing chronic conditions like diabetes and heart disease and obesity. And they kind of put out a little primer that shows that doing yoga, light exercises, meditations, doing deep breathing exercises, taking warm baths, all have a chance to calm the brain down. And that calming down allows you to have reduced back pain and reduced headaches, and reduced chronic pain. So they just kind of put that out there for that one for you guys. Also, the Journal of Clinical Psychological Science in November 2017 put out a brand new research also that was that studied females, so younger girls, from 2010 to 2015, and it showed that those girls who did 5 or more hours of electronic media consumption, whether it's YouTube or Facebook or Twitter, Snapchat, whatever it is, so girls who spent 5 hours online in social medias or consuming electronic media were twice as likely to consider planning or committing suicide. So that was actually a 65% increase from 1990. So that's quite a significant amount. So it shows a really good direct correlation that if you consume media online for more than 5 hours a day, particularly for younger girls, then you have an increased risk of having suicidal tendencies, whether that's discussing it or planning it or even committing suicide. So in this day and age of cyberbullying and where all of the information is right at our fingertips, and a lot of the schools are actually integrating Google and social media projects within their homework, it's going to be really behooving upon us parents to kind of take a step back and say, okay, well, yes, this is a good thing. This is a great thing that we actually have this information right at our fingertips, but also taking a step back and saying, well, what is this doing to my kid? So something to consider. Another issue on lifestyle or wellness is the American Heart Association came out in November 2017. It's got some new recommendations as far as longevity goes, as well as recommendations for those people who are at increased risk of having heart diseases. So what it found is this brand new study showed that this is not going to be good for you meat eaters out there, or vegans. But those people who had a diet that was rich in green leafy vegetables, basically plant-based diet, with fruits and beans and whole grains and fish, by the way, with very low processed meats. Those would be like the processed, like bologna and pastrami, anything that's in plastic, or people who had starchy foods or sugars. Either way, if you take that diet, it's a plant-based diet, and actually consume it and live by it, you have a 42% lower risk of developing heart failure in comparison to those who eat a normal standard American diet. It's called a SAD diet among healthcare providers. So SAD, the SAD diet, Standard American Diet, and it is sad. So, so again, I know not all of you are big vegetable eaters, but just by reducing your normal intake of things that create inflammation, will actually have a significant improvement in overall health longevity. One thing that we make a recommendation here at my office is that if you put something in your mouth and it starts to dissolve immediately without you chewing it, then you probably shouldn't be having it. It means it's a simple sugar or simple carbohydrate, and it's going to rapidly metabolize, and then we're going to have a whole bunch of other issues. Carbohydrates are good. We need our carbohydrates, but you need to be able to work for those carbohydrates. So chewing is really important. So again, if you put it in your mouth and it just kind of melts away, then you probably shouldn't be having it. Also, generalization here, but if it's white, it's probably processed and you shouldn't be having that either. So things to consider. Another interesting study came out in November 2017 by the American Academy of Ophthalmology showed, which is kind of cool, they actually did a study that correlated moderate to vigorous exercise reduced your glaucoma 25%. So that's pretty cool. Again, it's another study that shows that exercise is a good thing for you. Yeah, it's kind of weird. I mean, we've been saying that forever. A really neat thing is for chiropractic and osteopathic medicine, the providers who do a lot of manipulation therapies. My office here gets this a lot, by the way, and I mean a lot. It's probably one of the top things that I tend to see at the Natural Health Center here in Medical Lake is a study out of Turkey. It's from the Turkish Journal of Medical Sciences in August 2017. Showed definitively that if a person has poor spinal curvature in their mid-back with pelvic tilt in the lower back, then there's a positive correlation to that with urinary incontinence. So for ladies in particular, because their urethra is so small, they tend to have a little bit more urinary incontinence as they grow older. It's called stress incontinence. But as the spine shrinks, there's not as much room in the bladder to actually do its job. So it kind of squishes together. And the urethra, instead of being this long, it actually squishes this long. And then that mechanism actually causes the person to have stress incontinence. And this study showed that by getting regular chiropractic care, getting regular osteopathic care or manipulation care, tended to actually reduce the occurrence of incontinence. And I say it's one of the top things that we treat here is because it is. Chiropractors have a little bit different look at it, mainly because, at least in the form of chiropractic that I perform, and there's 150 different subsets of chiropractic, but the form that I do, we focus heavily on neurology and how the autonomic nervous system works in relation to spinal health, which is why a lot of people say that chiropractors are quacks is because they don't really understand the neurology that's associated with adjusting and manipulating the spine and how much it affects the body. So, when we treat it here, we treat it from a neurological basis as well, because a lot of those nerves come out of the sacral plexus, so really lower back, and by stimulating those nerves to work correctly, it allows the body to work better. And in the case of the bladder, it allows a stretch reflex to actually occur, and the body's able to actually expel the urine correctly. You don't have that residual urine, which can lead to chronic bladder infections, urinary tract infections, and interstitial cystitis. So that was your daily dose today, and hopefully you enjoyed it. And don't forget to subscribe to the channel and like the video.